Today we're going to dive into the 12 specific groups of people who should start antiviral treatment immediately if the physician suspects they have the flu, even if they're not in the hospital. Clinical guidelines suggest that if you fall into a high risk category, you should not wait to see if you can get better on your own. So this includes individuals 65 years and older. We're not trying to be ageist, but you don't bounce back as quickly and as well once you get that sick. Residents of long-term care facilities are exposed to a higher number of infections, people who are pregnant or up to 2 weeks postpartum, certain ethnic groups such as non-Hispanic Black, Hispanic, and American Indian or Alaska Native persons who often face higher complication rates, and those with chronic medical conditions such as asthma, COPD, heart disease, liver disease, diabetes, and those with class 3 obesity, such as a BMI of 40 or more, if you have neurologic conditions such as cerebral palsy or epilepsy, or if you are immune suppressed, such as from having HIV or being on transplant medications or being on chronic steroids. Even if you aren't in one of those groups, you should seek treatment if your illness is getting progressively worse. This is true even if you're not in the hospital or need to be hospitalized. So why take the meds? For patients who are not in the hospital, antiviral treatments with neuroamidase inhibitors such as Tamiflu can shorten the overall time that you are sick. And most importantly, it can reduce the risk of severe respiratory complications, such as ending up on a mechanical ventilator. So if you are on this list or you know someone who is, and they're fighting respiratory symptoms, get tested for the flu, but do not delay treatment if there's a high index of suspicion that you have the flu.